When we're doing a digital denture, the first thing we want to do is make an assessment of the dentures and have a conversation with the patient. That's going to determine the workflow. So if the patient's happy with what they have, it's just not fitting well, that's going to be what we call copy denture. We're going to take a wash impression, we're going to scan that, send it to the lab, say, hey, we like this denture, we just need it to fit better. I recommend a new denture every 5 years. A lot of our elderly patients, they lose weight and then those dentures don't fit because the tissue shrinks. And we know very predictably that bone resorbs with time. It's about 0.2 millimeters a year, but after 5 years, that's a millimeter of bone that goes away, and so that denture's not going to fit as well. Now, we do have patients who had immediate dentures done, and maybe they don't like the way it looks. The teeth just weren't set in the right position, midline's off. At that point, it's a different workflow. Now, that's what we call the reference denture. So before we scan, we need to assess the borders, make sure we got proper extensions, no overextensions, and also the VDO. If we need any changes in VDO, we're going to do that before we scan. So the best way that I found to do that is if we have a decreased VDO, we need to open that with a mush bite, and we can scan that later on. If we need to decrease, we're going to kind of adjust that denture and down until it's at the VDO we want. Do our border molding, and then I'll do a medium body wash inside that denture. At that point, we're going to clean up any excess PVS that's going to get in the way of our bite scan. So everything should be a 360-degree scan outside of the mouth. We want to make sure that we're accurately capturing anything that's going to touch tissue. So hard or soft tissue, that needs to be a perfect scan. Now, if you have some voids on the palate, something in the mid-flange area, that's something that Vitality can clean up for us. Just make sure you have that intaglio in the occlusal surface of the teeth. Once that's done, we're going to put those dentures back in the mouth, and we're going to do our bite scan. So for increased VDO, this is where we're going to put in that jig and increase that scan at the increased VDO. Or if we're happy with the VDO, we'll just do a regular bite scan. Most important thing is we need 3 pictures. So we need a full face smiling, we need a profile in repose, and then we need retracted in occlusion. That's going to help Vitality digitally design this and make those changes that you want. Then it's up to the doctor if they want a wax try-in or if they want to go straight to final. So 95% of the time, I don't even do the wax try-in with teeth. Usually it's a fantastic fit with great retention, something that we just don't predictably get in analog.